Not all hoarseness means cancer. What is hoarseness? Hoarseness means there is a change in your voice from your normal voice. That means it is sometimes breathy. Breathy means it becomes like that. This is my normal voice. If my voice becomes like this, that is breathy voice. Then there is harsh voice, like that. That is harsh voice. So if any change from your normal, which is normal nice tone voice, to any of this breathy quality, harsh quality, that is called hoarseness of voice. And nowadays, people think that anything. Most of the people I see in the OPD, they are very scared of cancer, especially if they are smokers or if they drink occasionally. Also, they get scared and they come and ask, please rule out cancer in me. Most of the time, it is not cancer. There are a lot of benign conditions which can cause hoarseness of voice. But having said that, if anybody has more than 10 to 15 days of hoarseness of voice, it has to be evaluated thoroughly by an ENT surgeon. So, what can cause hoarseness other than cancer? Most of the time, the most common cause of hoarseness is viral infection. When you get a viral infection, you may initially have a throat pain. Later on, the infection may go down to your voice box, and then you will develop a lot of difficulty in breathing. Like sometimes you may have difficulty in breathing with cough. The repeated cough causes inflammation in your voice box, redness, and when people generally don't give a voice rest and they keep talking, so the inflammation becomes worse and the patient ends up having a very hoarse voice. Usually, viral infections, once you give a voice rest and you take medications for pain and for cough, once the cough and the inflammation settles, the larynx recovers and the hoarseness will get better in a week or two. So anything more than 2 weeks, you have to still evaluate. But viral infection caused hoarseness typically lasts between 1 week to 2 weeks. And another thing is, another cause of hoarseness is vocal nodules. This especially we see in young, like 6 to 12-year-old children who scream a lot. They will be playing in the excitement, they'll scream. Regular screaming, what happens is we have got two vocal cords inside our voice box. So they have to come together like this, from the right side and left side. They have to come together and they produce this voice. So the air column, which because of this movement of the vocal cord, the air column which passes from the lung to the voice box vibrates, and that gives a characteristic voice. Because of this constant screaming, the vocal cords rub together, particularly in one area, that is junction of the first 1/3 and the second 2/3 of the vocal cord. They have the maximum friction when you scream. So that area develops this continuous trauma, and just like when we do harsh work with our hands, we develop calluses on that particular part which we use to do the labor. Like that, the calluses develop on the vocal cord. They are called vocal nodules. So this is especially seen in young children who scream a lot, but it can also be seen in people who have a job which requires hawking, like people, conductors, teachers who have to continuously keep talking to students in higher voice so that all the kids in the back of the class listen. So generally, people who have to use their voice a lot and at a higher pitch are prone for this. And sometimes singers also can develop the vocal node because of the high pitch singing can cause this problem. How do we treat it? The surgery is not required for this in this routine recommendation. One of the famous singers who has undergone the surgery for this vocal nodule is Julia Andrews. So surgery is not the first option. Usually when you give adequate voice rest, this shrinks away. Just like the calluses disappear when you stop doing the hard work, like that the nodules go away when you stop screaming. So in children, we can't make them you need behavioral therapy, and sometimes we have to take them to speech therapists who will teach them how to shout, like how to not to shout, and if they are also using the voice hypertrophy, how not to traumatize your voice. Many times we have adults also with the same issue. You have to undergo speech therapy. Along with this, we give sometimes antacids, because when there is acidity and reflux, that increases the inflammation of the voice box. So acidity and GERD, what we call gastroesophageal reflux disease itself can cause a lot of inflammation in the larynx, and also sometimes can cause hoarseness of voice. Another main category which I would like to point out is because many people, young people, even the increasingly younger women, I'm seeing smoking is becoming very common. It's not a great habit. Smoking itself can cause hoarseness. How? It can cause something called edema of the vocal cord. Edema means swelling of the vocal cord. The smoke air that you inhale from the cigarette, they contain a lot of this hydrocarbons which can inflame your skin of the throat, and that can cause swelling of the vocal cords. So this is technical term is called ring case edema. When you have the vocal cord is supposed to have a very the muscle inside, and on top of that there is a skin layer, and between the skin layer and the muscle there is supposed to have a pulpy collagenous tissue which allows the skin of the vocal cord to slide over the muscle. So this viscous layer is very important for the voice quality and the pitch and tone and all of the voice. So if this vocal cord becomes edematous, the edema, the swelling happens in this layer. So this can cause because of the irritation caused by the harsh chemicals in the cigarette smoke, this area gets inflamed, and that still can cause the smoker's larynx or hoarseness of voice. So, and also later on it can cause to continuous coughing, like hacking cough it can. So the treatment for this is of course stopping smoking and anti-inflammatory medication. Sometimes even we give steroids to reduce inflammation of the vocal cord, and we don't use surgery for this kind of patients, but in some cases, extreme cases, we might have to resort to surgery to treat it. Another, like I said, gastroesophageal reflux disease, most of the time nowadays I'm seeing with a lot of people with a lot of stress associated with the job and change schedules of the jobs, like people doing night shifts continuously. So to keep themselves awake, they'll drink a lot of coffee in the form of caffeine tea. So this also can increase the gastroesophageal reflux, and most of the time we see the gastroesophageal reflux or acidity being like additional factor in all these conditions. So these are the common conditions which can cause hoarseness other than cancer. But anybody, an older person who has had a history of smoking for a long time, and if their hoarseness is not disappearing after 10 to 15 days, please make sure that that person gets evaluated. Usually we do an office evaluation using something called laryngoscope. We can either use a flexible laryngoscope which can go through the nose and look at your throat, or a direct laryngoscope which is seen through the mouth. And most of the places in our doctor's offices, we have now videos which will show you the picture of the vocal cords and how it looks, and we can diagnose this lesions. Another lesion is vocal cord polyps. Polyps also happen when we sometimes scream and all. We may be vocal cord hemorrhage, and sometimes after the hemorrhage, that area may organize into hemorrhagic polyp, or trauma with the healing can cause a polyp in that area. These are all benign. They are not any cancer ones, but still may require surgery to remove that particular polyp from that area, because without that, the vocal removal, the vocal cords cannot close completely, and that allows the air to escape, resulting in a breathy voice. And every time the person talks like this, their effort of speaking increases, which in turn adds to the inflammation of the vocal cords or the voice box itself. So these are the conditions which can cause hoarseness without being cancer, and they can affect your quality of life. If you have hoarseness, please get yourself evaluated. There is treatment available.